Hello, hi
Hello,
everyone.
hi, and welcome back to this week's video blog.
Yeah,
This one is part 4 in a series entitled The Importance of Being One's Own Healthcare Provider.
yeah,
Wow.
very important.
Yep.
All right, so let's get into part four. Hello, all right, and welcome back. Okay, in the previous three blogs, we have learned that drugs don't really work, nor do the natural remedies, especially if one continues to lead an unhealthy lifestyle. And in the not too distant future, you might not be able to make an appointment with a doctor or other practitioner because there simply won't be enough of them.
Yeah, I mean, there you go. And again, like I said, we're basically talking about the drugs and the medication that are for chronic illnesses like lowering blood pressure, blood sugar levels, blood fats, and things along those particular lines, and things that are supposed to make pain go away, and things that are supposed to make you happy. So, yeah, pretty much all the drugs.
All right, so like it or not, this means an individual, if he wants to be healthy, will have to learn how to live a healthier lifestyle. And those practitioners who can lead the way will become more and more valuable.
Yeah, and that's really it. You're going to find that the doctors of the future, so to speak, aren't going to be really administering treatment as much as they are advice and things that you can do to take care of yourself. Because unfortunately or fortunately, that's the only way you stay well. It's the way you live and you conduct your affairs,
Mhm.
and so on and so forth. You know, I could say, well, I got a pill that'll make you this, I got a pill that'll make you that, and all the rest of the stuff. But the fact of the matter is, there are no such pills. There never will be such a pill. And at some point, it's your own responsibility and self discipline that puts you to bed to make sure you get 7 to 9 hours of sleep and things along those lines. So there you go. I mean, it's just going to be advice and encouragement, and that's going to be about it.
Yeah, and interestingly enough, I don't know if this has ever happened to you, but I see it quite frequently. You'll go into the medical system with, the sniffles, runny nose, everything screaming of viral infection, and you'll leave with a prescription for an antibiotic, an antibacteria. And physicians know that an antibiotic is not going to cure an anti or a viral infection, but they do know that patient satisfaction is increased if they leave with something, even though if you do truly just have a viral infection, taking an antibiotic is the last thing that you should be doing.
Yeah.
Not going to be effective, and it's actually going to tank your body's innate immune system anyways. So it's like
Yeah.
we got to start thinking.
Yeah. That's true.
All right. So, if one truly understood chiropractic philosophy, this would mean that chiropractors are poised to be the healthcare practitioners and instructors of the future.
I really think so. You know, if the philosophy of chiropractic is actually spiritual. It's not very scientific, and a lot of people try and show and demonstrate that chiropractic is scientifically this, that, and the rest of the other things, and what it does scientifically. But what it essentially does is it opens those communication lines between the great animating force of the body and the natural world and the body itself. B.J. Palmer once said that he adjusts the spine and God does everything else. Um, however you want to look at it, but you really get the idea that there is a healing energy, there is a life energy, and that is how. And if a person is separated from that, they will not heal, they will not recover, they will not live and survive.
Yeah.
And so, and to me, that involves your lifestyle. So if you really understood that, it's like, well, then everybody should see a chiropractor, whether they need adjusted or not. There's a lot
Mhm.
of different things that we can do.
Yeah.
Yeah. So,
Yeah,
but
it seems in the whole gamut of what chiropractors can do, the philosophy behind it, the power behind it. Unfortunately, it seems that all chiropractors want to do is make videos of cracking people and put it on YouTube.
I don't get it. You know, they'll mic it up, they'll grab somebody, and a big cracking
And
noise.
the funniest thing is I saw a video of someone doing that, and we hear cavitation or that bone popping all day. We're very familiar with the sound. And the sound this was making was that of someone crushing a water bottle. And so I was like, okay, I'm just going to do a little experiment. So I closed my eyes and I scrolled through the videos. and it was the same exact crunching sound superimposed on every single video. So it's not even the true cavitation. And then, it's doing a disservice because the crack and the crunch has absolutely nothing to do with the power of the adjustment. So, it's really that motion, the liberation of interference from the nervous system, allowing those communication pathways to open up. That is where the magic happens. It is not a pop, a click, a crunch, or anything like that. So proceed with caution yet again.
Right. When I was in chiropractic college, we had a technique course, and the instructor was up there, and he was talking about this technique, this adjustment called the master cervical. Brutal. But yeah, it's pretty intense. But he gets up there and he starts going through the whole Clint Eastwood thing about, this is the most powerful adjustment, the master cervical, and can tear your head clean off your shoulders. Do you feel lucky? Well, do you, punk? And we're all sitting there watching, and it's just sort of like, okay, whatever. And he sets this guy up and he does the maneuver. And this cracking noise was, we thought he had killed the guy, right? So he starts laughing and he reaches in his pocket and he had those huge muscatoli noodles, pasta, and he put it in his mouth and he bit down on it at the same time. One of the things
that's a cruel joke.
Yeah, one of the oh my God, they killed. One of the other things that they said is what you can do sometimes, since people like the cracks, is put your fingers down so that you're this way and just pop your knuckles when you push on. But it's all joking. It's not. But I mean, that's the significance of.
And here's the thing: if you're going and seeking care solely for a crack, you're missing the point, and you're missing so much of the true magic that happens with the adjustment. Yeah. Of course, it's that cathartic. You feel or you hear that release, and you say, "Oh, that must have done something," but it's not the point.
Yeah.
So here, let's continue on. Am I convincing you to be more of a participant in your life than a spectator?
Yeah, that's a good thing. You're just going to pull up a chair and watch, or you're going to get in there and...
Yeah. It's easy to think, well, I'm not going to be around in X number of years, so I won't have to deal with this stuff. Followers of my blogs and vlogs will tell you that that being the soul or spirit is immortal, and that at some point each of us will be coming back to this planet, only now with a new set of parents and a baby body that is just going to have to go through all the stuff each of us has gone through in a world that will most likely be more debased and aberrated than the one we left.
Yeah. And that's a little bit heavy, but it's kind of true. I mean, we could work on it now. What was that? There was a commercial years ago with some auto thing or something. It's like, pay me now or pay me later. And it's just so much easier to work on things and work on your humanity and improving yourself and your wisdom and so on and so forth right now, instead of then all of a sudden you're in a point or a position where now you absolutely have to, and you're not even really sure what that is anymore. So, yeah.
All right. At some point, each of us will have to confront that which we were unwilling to confront, be responsible for that which we were unwilling to be responsible for, and learn again what it truly means to be alive.
Yeah, I know he's fallen out of favor, but Bill Cosby a number of years ago had a comedy routine where he had this sullen face and these gray circles around his eyes, and he was just talking about different groups of people, and that we just need to put them someplace. We need to put those people someplace. We need to put those people. But when you really start to think about confronting and how many billions and billions of dollars we spend in this country for our lack of willingness to confront, we need some place to just put those old people that are kind of not doing real well. You're going to be an old person one time yourself pretty soon. You might want to figure out how to do this. You might want to confront this.
Yeah.
You think of the things with people hiring attorneys because they simply will not confront and communicate. You look at the number of surgeries and drugs and stuff like that. Fix my body and save me. Again, an unwillingness to confront. All the money that's spent on education, public schools and university degrees and so on and so forth, simply because we're unwilling to confront the ability to learn and know and to teach our own children and things along those lines. I know that kind of gets off course a little bit, but we're all going to have to confront this thing. And to the
Yeah.
degree that you confront it now, you'll be able to later. As a matter of fact, it won't look like such a big deal. If you could confront, uh, you know, elderly people right now, when you get to be that point, it's not going to be that big of a deal.
Yeah. So why not work on it now? Better people means a better planet.
Yeah.
Why not work on bettering yourself and those around you? Each of us is going to have to someday anyhow. Why not now?
Yeah.
Just a thought. Yeah, it's so true. You know, everybody's been that person that has been in that other group. And you know, you've always wanted someone to be there to lend a helping hand, who's been there before, who, you know, has confronted that issue before, to lend actual guidance, not just, oh, we'll just stick you in this pile over here and we'll, you know, cross our fingers that things will go right. And, you know, that rarely ever works out. But
Yeah, that's the whole thing. I mean, there are plenty of healthcare professionals and things like that that are in various disciplines and so on. And I'm not sure why they're not really looking for something that would truly work. I mean, at some point we're all going to be in this position, and we're going to need help. You know, um, I could go off on whatever, but I won't name any names or anything. But you know, you have this opportunity to help people do better, and in essence, you will do better yourself. And
absolutely.
you know, that hand that you're looking for or will be looking for someday is created now. Um,
And realistically, it should be your future hand reaching out to yourself.
yeah, yeah. So
Yeah.
yeah, all right.
Okay, so next blog/vlog, we'll talk more about pursuing life and living this rather than treating diseases and disorders with the hope that we will somehow have more life. Until
Yeah,
then.
yeah, that's really good. I like that because the diseases and disorders are the consequence of something. And by the time you have this disease, it's been, you know, it's gone through many steps and many phases.
Yeah.
And that's essentially.
My dad kind of, we were laughing, but not really. He brought up the fact that, you know, our bodies have adapted and survived for millennia and millions of years, adapting and surviving and creating. And he goes, and we break them. And it's really true. And it's not really all that funny, but your body will adapt and it will try. And then once we actually see the physical manifestations of a disease process, that's when people start to pay attention. But there has been so many things that have been your body's been trying and working, and then it's like, you know, okay, well, now we got to really kick the door down and make you listen. But your body's, it's talking to you, it's trying.
It's so far down the line that it's not even worthwhile treating the disease or disorder. Like I said, it might be 10 or 15 steps removed, maybe even more than that. It might not even be related, as weird as this sounds, to this lifetime. How about that? So yeah, so you pull this back and you know, work on you, and don't chase diseases and disorders. And you'll see, we've got some other blogs coming up and so on and so forth. And it's just something to think about. And if you have an opportunity to take care of yourself, you probably should.
Until next time, take care. Be sure to like, comment, subscribe, and share to anyone you think might like this knowledge.
Yeah. Hit that old like button.
Take care, guys.
Thank you. Take care.